Well, thank you so much, Dr. Dua. Such a wonderful introduction and so heartfelt. And thank you so much to all my friends and colleagues and mentors that are here. I'm going to probably get emotional a few times during this talk, but it's really truly an honor to come back to Stanford and to share, my thoughts on what this place meant to me as a resident and then in my early career. And I'd also like to thank Dr. Hahn, Dr. Kabebu, Dr. Spain, all the program leadership, and Gina too for coordinating everything. So I think it's safe to say this is a very different talk than I've ever had to give. It's been 10 years since I was a resident and graduating from this program here. And it's really offered me a great opportunity to think about and really reflect on what my time here was and what it meant and how these lessons continue to help me moving forward. So I titled the talk Leading from the Heart to characterize these reflections. And as it's the Thanksgiving season, I just did first want to give a moment of gratitude to really mark how special this opportunity is to me. And I think it's really safe to say that I never thought that I would become a surgeon, that I would graduate with such wonderful colleagues, and that I would have a career that I love in breast surgical oncology. And so I just appreciate the opportunity to share some of my small contributions. Also, it's even more of an honor when I think about the other alumni who've been honored in this way in this lecture series, truly giants in academic surgery, Dr. Lee, Dr. Yang, and Dr. Wang. And, I definitely am an alumni. The degree to which I'm distinguished, I think, is still, I'm figuring out. But I hope to share with you, all my friends, some of my thoughts, and then also for the prospective residents, I hope that you can see that the foundation that you'll build here at Stanford will really help you for a future that you may not even realize right now. So I think that the first reflection is that residency really is a process, somewhat of a metamorphosis where you're growing, through the years as an intern, as a chief. And I remember that before starting my time here, my intern year, I was really terrified at this transition of being a student and going to being a doctor. And I was so thankful that I had such a wonderful class of interns, Steph Chow, Cindy Kin, Ellen Morrow, Arga Gonzalez, Greg McGee, and we really, really served as a bond for each other. We were invited to the Chiefs dinner before starting intern year. I don't know if Cindy remembers. And I remember somebody telling me that I looked like I was a deer in the headlights. I really was scared to start as a resident. And my first rotation was on the trauma service. And I remember my first case was with Dr. Greg. It was an excision of a lipoma on the posterior neck. And it was a busy service. It was in July, but I think it was the best introduction that I could have had to Stanford. My chief of the service at that time was Charlotte Owens Sunberg, who was an incredible role model, who really took me under her wing, showed me the basics of surgery, helped me navigate the hospital, and I think also really set aside time to teach me how to be a doctor and what it meant. She shared with me her philosophy, how she approached patient care, and I could see in her interactions with patients the way that she would connect and the way that she would care for them, and I really learned a lot during that rotation. And at the end, I don't know if Dr. Spain will remember, but I always am trying to seek feedback and figure out how I can do better. So I came to his office to meet with him to ask him how I can do better. And he told me that, I was doing a good job, it was my first month, but that he wished sometimes he could give me a confidence bolus, like a normal saline fluid bolus. And, over the years, I've definitely could have used that even, today. And I used to always be so nervous on Sunday nights. I wouldn't be able to sleep. I think looking back, it was probably anxiety, but I didn't recognize that at the time. And it was because on Monday morning, early morning, we always had M&M. And I love Dr. Norton. Dr. Norton, somehow he figured out, he knew my name, and he always called on me every Monday morning of my intern year. And I never felt I could prepare for that, so I was just always so stressed. But over time, I really came to, love the M&M process and learn that it's really an opportunity for us to reflect on how we can do better for our patients. And I learned so much in those times. And then I think the other thing that was really special over the years was the professional development time. This was like a breath of fresh air. I really appreciate that Stanford, allows us to take the time that we need to develop our career in whichever way that we see is important. I definitely don't have a passion for basic science research. That would never be something that I would be able to pursue and excel at. And it was really working with Dr. Jason Lee and spending that wonderful year with him, where I also got to meet Dr. Dua, working on education research and clinical research in vascular surgery. That helped me learn so many skills in research. And I was able to then also go on to do a master's degree during that time, a master's in public health with a focus in health management and policy. And that was also such a wonderful experience that I think has continued to guide me to this day. So somehow over the years, I was able to mature as a surgeon. And I think that was because of all of you in this room and many of you who are not, and everything that you shared with me and everything that I was able to contribute as well. And some of the things that I can share some memories with you, the things that stand out, but I'll just really never forget those times. And so it's these moments that build on each other throughout all the years that help to form, to make us into surgeons. And as Dr. Crummell, who was the chair at the time, used to always say, this is surgical residency, you have to trust the process. And I think he was really correct with that. And I also want to just thank Dr. Greco, Dr. Curette, and Dr. Melcher, who were my program directors over the 7 years. And really, I can 100% say that without them, I would definitely not be here today. And I think that, it is true that even in residency, life will happen and things will continue to go on. It's a long time. They're very formative years. There's ups and there's downs. And, when I reflect back on my time at Stanford, the thing that stands out to me the most is not a specific operation or specific case or specific patient or skill that was developed, but really it was the things I learned at the start of my third year and throughout the rest of my time. When I came back into residency after completing my public health degree, my father unexpectedly passed away. And this was a really devastating moment for me on a personal note. And, I'd never experienced anything like this, where somebody who I loved so much was there one night and then the next morning he wasn't. And I was really heartbroken and really shattered. And I never will forget how much everyone here really supported me, cared for me, and looking up at his funeral and seeing Charla and Cindy and Monica all there and everyone who helped me along the way. And the third year, I think, was really a rough one for me because of this. Third year also is already very challenging. In some ways you're an intern, in some ways you're a chief, in some ways you're, not an intern, or you're not a chief. You just really are trying to find your way. And I really felt that during that time, I knew I would be sad, but I didn't really expect to what depths that would be. I don't even know if I should share some of the challenges that I experienced, but I would sometimes have a hard time coming to the hospital. I would come in, I would go to the chapel right there at D1. I would spend a moment. I would try to go about my day. I just knew that if I wasn't able to continue, my father would be so disappointed in me because he was so proud that I had become a doctor. And so I, kind of similar to this road, just could not see the way ahead. And I really think that, and credit, this program, and in specific, Dr. Melcher, for helping me find my way. He was my program director at the time. He called me into his office. We took a walk down Welch Road. Probably we talked for like an hour or something. I don't know. It felt like a long time. And I think it was a testament to how much my colleagues really were worried about me, and that I just was not myself. And I think a lot of this was thanks to the admin chief residents at the time, Dr. Tedesco, Dr. Slater, who really, I think, opened up this moment. And so Dr. Melcher encouraged me during that time, during that talk, to take a few weeks off to really grieve properly. And, I told him, I'm a resident, I can't take time off, I'm on call. And he told me, somebody else will take your call. You would do the same for them. And the thing that really struck me in that moment was he gave me the perspective by sharing with me that if I would take a little bit of time now, I would have so much more that I would be able to contribute later. And I think that that is really true. And that's something that I've held with me as I even mentor other fellows and residents and even junior faculty, even my own peers, you know, that in times taking a few moments to really honor what has happened, to deal with those emotions, and to be able to move forward is something that can help us as we continue to care for patients and help us to connect with them. And so in training, you know, we're also still living, things are going to happen, and it seems like a lifetime, but really it's a short span of time that can help us to grow into our future. So since I have the opportunity, and since this was such a pivotal moment for me, I'd just like to share a little bit with you about my father, who I think was such an incredible human. And he grew up really from very humble beginnings in Ethiopia in the countryside, and really had a steadfast dedication to education, to learning, and went on to become, to get a PhD from UCLA and become a full professor in film and television studies there as well. And I think that, you know, when I think about him, I think that he is brilliant. I mean, he developed what's called third world cinema, which is theory, film theory. You know, I'm still learning about it myself, but focused on African, Latin American, and Asian films, and particularly those around liberation. And he was a really avid reader, and would get a hold of any book and read it. I mean, we have like tons and tons of books, almost a library in our garage back home. And he was such an incredible writer. Honestly, sometimes I have to sit and read over and over the words that he has written because they're just so eloquent, trying to understand what they really mean. And my most treasured memory as a child was going with him to the UCLA bookstore. And he used to go and read whatever his books and leave me in the children's section. And there, I think I would really discover my love for learning, my love for reading, my love for words. And I just really appreciate those times. And he was also incredibly generous. He, as I mentioned, came from very, very, very humble beginnings, but he was grateful for all he had, and he shared it with everyone. And when I was in medical school, I had an opportunity to visit Ethiopia with him, which was my first time visiting, and to see him in his element, in his home, you know, giving people the jacket off his back, you know, giving children in the street anything that he had, seeing in them what, you know, as himself, is really some of the things that I'll remember. And also during that time, I was able to see him in his element, so to speak. He was invited to give a commentary on a film screening or something like that. And just the way that he described the imagery in the film and all the aspects to it. I mean, as an adult, when you see your parent in that way, it's just so different and striking and fascinating. And I really am so thankful for those memories, among many others. And I just wanted to share this to share a glimpse of how incredible he was. And, you know, so you could understand how much I lost in that moment. And that he really taught me how precious life is and how we should really care for each other and be grateful for all that we have. Oh, and he even has a Wikipedia, which I think that's so cool. Okay, so he was a film professor, but he wasn't really, I don't think, a filmmaker. You know, this is, I think, the only short film that he made. It was in 1972, and I haven't seen it, but he talked to me about it, which is essentially he juxtaposed the elegant movements of a soccer player with that of a dancer. And I think that, you know, if I was a filmmaker, I would also add for us as surgeons as well. And so before he passed away, he helped me, he shared with me his dossier, which he had put together for his maintenance of promotion. And this was a concept that always struck me and I've held with me, and it's really resonated, which is, he said, I'm making the argument that at this moment of my life, when I have been in the position or profession for many years, that the range of my services extends far beyond my research records, far beyond my intellectual, scholarly, and public activities, far beyond my writing and lecturing about cinema and its relationship to the world. What I'm seeking to do, I would say, is validate the notion of the academic citizen, by which I mean an academic who has some relationship to the wider communities that surround us and which overlap with other arts and disciplines. And I think that this concept of academic citizenship, of being in academia, but also being in community, and really this relational quality to citizenship as a way to provide service to each other, to ourselves, to strangers, to colleagues, to patients, to our world, is really something that has struck with me. And I think in some ways, maybe I am seeking always to do the same. So in our third year, or my third year, is also when we lost Greg Feldman. So Greg Feldman was a remarkable surgeon and colleague and resident in our program. And after this loss, it really, I would say, shook this residency program to its core. And as a way to kind of make maybe meaning or purpose out of what had happened, Dr. Greco and Dr. Crummell put together a committee to help create a curriculum or a program to create balance in the life of our trainees. And this program has eventually became what's called the Balance in Life program. And Dr. Greco, who is our prior program director, and also Dr. Crummell, invited 4 of us residents to be a part of this committee: Greg, Argavon, myself, and Yulia. And I think that was just so forward thinking. When I was a undergrad at UCLA, I did a minor in public policy. And one of the things that we learned during that time was that for any policy change to be effective, it really had to include the people at the front lines. And I think by including us in kind of designing this program, they were able to do just that. And this, was very transformative at the time and very innovative. I mean, for the residents today, we talk about wellness, we talk about burnout, we talk about career sustainability, but these were not themes that really we were talking about at that time. And so I think this has really served as a model for others across the country. And we presented this actually at the ACGME meeting, I believe it was in 2012. And so what we designed were 4 pillars. And I think, I'd be interested to hear how this program has grown over the years, but 4 domains focusing on physical well-being, psychological leadership, and social well-being. And so for physical well-being, some of the things that we thought about were promoting healthy eating, physical activity, creating an after-hours brochure, which helped residents to develop or to have at their fingertips resources, physicians in the area, dentists, et cetera. Psychological well-being was focused around the class meetings with Dr. Lisa Post, which I think you guys still do today. But were so powerful because it gave us a chance to, amongst our colleagues and peers, talk about the different challenges that we were experiencing and helped us to, have a moment to reflect on these and that we're not really alone. And then for leadership development, we focused on having each class have representation in decisions, peer mentorship, team building, creating a big SIB, little SIB program between the junior residents and the senior residents to help socialize people into the program. You always had someone you could turn to. And then of course, social events, which are the most fun, to help us foster community and to help us create those bonds. And so you can see here just depicted some of the activities, the Goodman Center fridge that was fully stocked. I mean, this was like the best thing ever at the time. Exercise, which you don't see me in that picture, but getting people together, doing different activities, social activities, Lisa Post lectures, and I think our discussions. And I think one of the things that stands out to me about this time was, or one of my favorite moments was, as chiefs in one of our sessions with her, we talked about how, the interns don't really see the challenges that we go through as chiefs, which some of them are the same things they go through as interns. And the same for the faculty. We put people on a pedestal that they've never had a problem or, any challenge. And so we designed a inter-year big, I guess, session, so we had at different tables an intern, second year, third year, fourth year, fifth year, and talked about different issues. And I think that really trying to break down those bonds or those, walls to help us see that we really are going through the same things was a powerful moment. And I think also, as no surprise to anyone who knows me, I'm definitely not scared of emotion and can have a little bit of vulnerability. And I think that during these times, I was able to serve as a resource for my colleagues who were dealing with different challenges and would come to me and I could help kind of navigate them through that process. And in some ways, these foundations probably is what helped lead me to a career in oncology, where I was able to really have a desire to connect with people in this time that was so challenging for them and provide comfort and meaning, similar to what I had experienced. So I was grateful also over the course of my training that the rotation structure changed such that now there was a focus more on disease sites and service lines. So when I came back into my senior resident years, we had a fourth-year chief rotation on the breast surgical oncology service. And this was really, I think, transformative. So, up until this point, we did cases, but we didn't get to see really the whole picture that it takes to take care of a patient with breast cancer. I'll never forget also Dr. Norton, who shared with me once in a patient's room that, we're surgeons, of course, but we're also oncologists. And I think this is what really came through during that time. And, for all the prospective residents that are on the Zoom who I know want to go into a career in breast surgical oncology, I can share with you some of the things that brought me to this place. So the first is multidisciplinary care and really a focus on team science, that where everything is really all interconnected in the care. Surgery, as surgeons, we're only going to be as good as the radiologists, the radiation oncologists, the pathologists, the plastic surgeons, et cetera. So really there is that team dynamic. Also, this field has one of the strongest evidence base for practice, and it's rapidly changing. And I think this is also very exciting and fascinating. As time goes on, there may be a time where we don't even do surgery in some cases. For me as a resident, the patient-centeredness and the partnership with the patient was also something that was very sacred. I will never forget, even as a resident, being able to make an impact with patients directly and, them reflecting that to me as well. There's very complex and nuanced decision-making operatively and also non-operatively. There's definitely a focus on aesthetics and quality of life. As we get better and better with our treatments, more and more we're focused on quality of life and how to reduce the impact of our long-term impacts of our treatments on patients. And then I think there's a perfect balance of art and science of medicine. And then lastly, I won't ask for a show of hands, but I think it's safe to say that almost every person has been affected, unfortunately, by somebody with breast cancer, and that this is a very important, has an important societal impact as well, and a huge role for advocacy and elevating the patient voice, which is something that I always am seeking to do. And so I learned from my mentors, Dr. Wapner, Dr. Durbis, Dr. Johnson, Dr. Jeffries, and all the surgical oncology faculty as well, who really helped me to find my place in breast surgical oncology. And when I graduated from Stanford, I went on to do a fellowship at MD Anderson Cancer Center, which is the #1 cancer center in the world. So as you can see here, my other mentors, Dr. Kelly Hunt and Dr. Henry Cure, who were my chair and program director, and also continue to be mentors who've been, I would say, transformative in my career and my career path. And one thing that I'll also share is that during this time when I was transitioning to being a fellow, I'll never forget in that first month, I was nervous. You kind of go through residency and you find your way and you figure out how to, excel. And then you go to a new environment and you have to try to figure it out too. And it's a big place. I mean, it's like, 5 times the size maybe of the old hospital. But anyways, I remember talking to Maureen and sharing with her how I was nervous about this and everything. And she just encouraged me to rely on the things that I had done at Stanford and to focus on taking care of the patients the way I did here. And that would be really the way that I should move forward. And she was definitely right. And I think with that guidance and shift in mindset, I was able to thrive in my fellowship. And as you can see, the fellowship at MD Anderson has trained probably over 60 fellows at this point. I'm all the way down here. And it's really I think, been a privilege to be able to give back to this program, which gave me so much, and to be able to contribute to the careers of so many leaders in breast surgical oncology, so many emerging leaders, and really the legacy that helps to advance our field and impact the care of thousands, or if not more, of patients. And as I mentioned before, and I'm not going to talk too much, but just to share, one of the most fascinating things about breast cancer, and many of you may or may not be aware, but really there's been such a strong paradigm shift in our understanding of the disease, where we used to think of this as really a surgical problem with localized, disease in the breast and lymph nodes, and do really extensive surgery. And really over time, we have found that breast cancer is more of a systemic disease, and it's not a one-size-fits-all disease. There's different subtypes and types, and that multimodality therapy is what has allowed us to actually even do less and less surgery with better and better outcomes, and really focus on personalizing medicine. And so the field at this point is, I would say, really focusing on how to de-escalate our treatments, to do less surgery, and also to focus our treatment on the right patient at the right time. And when I think about the impact that, an oncologist or a surgical oncologist can have, of course, we all know about bench to bedside and basic and translational research, but there's also taking what we learn, from the bench, from the bedside, and bringing it into society. And when I think about this more from a standpoint of dissemination. So through education and career development, knowledge, and sharing best practices, and also clinical trials and clinical research. And so for me, I think my career has had many parts and many small contributions that I think, add up. So I, am first and foremost a clinician, a breast surgical oncologist, treating patients in the clinic and in the OR. And I think that these have been the most rewarding experiences for me, especially when I'm able to help a patient to feel empowered in their decision-making, and also to help them to feel seen in the process. Also participating in clinical trials and research, and I've had the opportunity to participate kind of across the spectrum, from even serving on the IRB, being a PI and collaborator on different studies, doing clinical database research, learning from a lot of the skills that I learned here, and also through peer review. And for some reason, I love scientific editing and writing. So, but don't give me all your reviews, okay? But I do love to do them. Education, as I mentioned, through our fellowship program, also the CGSO fellowship program, the GME. Working with my colleagues, we've been able to do some very innovative things, like start a clinical trials course for the fellows, and really focus on helping to bring into their careers, all the different aspects that we have. One of, I think, also the most fun things that I've been able to be involved with is career development, and not only for fellows, but, a few years ago at our institution, they started a mid-career faculty committee, and a lot of focus gets put on early career faculty, but not that much on the later years. But honestly, this is, I think, the most fertile ground with which careers can really grow. So having this opportunity has been so informative for me and my own career, but also such an opportunity to give back to my colleagues. And then coaching. So I had the opportunity to do a leadership development course in coaching and become an institutional coach. And I really did this initially to help me to be a better teacher, I think, and a better program director. But it's also been a wonderful way for me to learn more about myself and to be able to help others. I've been fortunate to be involved in several institutional and other efforts focused on diversity and inclusion, which I think are definitely core values that I hold. Advocacy, as I mentioned, bringing forth the patient's voice, and then through engaging in professional societies, extending what I've learned and sharing what I've learned across the way, and learning from colleagues as well. And so I wanted to just share one aspect and one very small contribution that I've been able to make in a team, and this also includes Dr. Morris and Dr. Stoudemire, and that's through the operative standards, which I'm not sure if many of you know about this, but the rationale behind the operative standards for cancer surgery was that cancer care has become so much more complex and so much more personalized, and really we look to guidelines, national guidelines, to guide our medical management and clinical care. But there have, until recently, not been any guidelines or any defined process standards around the operations themselves. And we know that most curative treatments will include surgery. And so that led to definition of the operative standards, which are critical elements of an operation that are associated with an oncologic outcome. and they involve really the technical aspects of the case, so from skin to skin. And the idea was to set a minimum standard by which we should all achieve. And these were really developed by a comprehensive systematic process by expert level working groups in different disease site areas. And I'll talk a little bit about how we've been able to kind of move that forward. So here you can see the 3 volumes that house all of this data and these operative standards that cover 15 disease sites. And from this work that was done through the American College of Surgeons Cancer Research Program, a new cancer program was formed, which is the Cancer Surgery Standards Program. Here you can see. And this was really with the foresight and vision and leadership of Dr. Heidi Nelson, Dr. Matthew Katz, and Dr. Kelly Hunt. And I was so fortunate that they invited me to take a role as the chair of the education committee. So here's just an example for breast cancer, since that's my area. And so you can see here 4 operations that they highlight and the different critical elements of each operation that are linked to oncologic outcomes. And when we take a look at just sentinel node biopsy, the first element is identification of all sentinel nodes. And you can see here that they outline the recommendations, the data, the strength of the recommendations. There's rationale that's also included as well. And so this is done for each element. And these standards were, developed and they were available, but they weren't really being used in practice. And so really through a partnership with the COC, which cares for over 70% of the patients throughout the country, we were able to operationalize and have a sort of dissemination implementation arm for the operative standards. And so in 2020, the COC adopted 6 of these standards. And as I mentioned, they apply to cases performed for curative intent. And they outline the technical aspects and also documentation that should be in a synoptic format. And so this is just an example to share with you those 6 standards, the 6 operations, the disease sites, and also the documentations recommended. And so through our education committee since 2020, which in some ways we were like a startup of sorts, we were able to work with the COC and work with our colleagues to develop multiple educational resources and really, I think, be the kind of forward face for the cancer surgery standards programs as they rolled out this initiative. Oh, and then you see here, everything is housed in our toolkit. And I just put this here to show that it really definitely is a team effort. Like I mentioned, my contribution is a small one, but definitely I think this has been a really meaningful activity for me in the past, I would say, few years. And so now, when I look at this image of this road and you don't know what's ahead, it really, I feel, is a more expansive future. So, I don't know where it will take me, but I'm excited to continue along. And I'm excited to join the faculty at UCLA, which gives me an opportunity to provide a meaningful contribution where I grew up. So in closing, I'll just share that, as I was reflecting and getting ready for this talk and taking a look, I went to look at my photos in my iPhone because, I got an iPhone when I was a resident here. And over the years, I've amassed a lot of photos and screenshots, as you can see here, over 45,000. So the first one, of course, from 2009 is a photo with Anita, which I thought was very fitting. And this is in the offices. And then the last one, when I was putting this together, is with Monica's children, Ethan and Mia, because I got to spend a few moments with her earlier this weekend. And then here's the tree, from spending Christmases as a resident here at Stanford. And really, looks like I keep everything in my phone. And even you can see this, I don't know, a photo of the liver anatomy, which is something I really treasure to this day. But it's from pre-op conference, and I am very thankful to Dr. Pultsides, Dr. Visser, Dr. Norton, because really those foundational principles in surgical oncology also helped me so much as I have gone on in my career in breast surgical oncology. And then I think that, you know, I can't do a photo dump of like the 45,000, but some of the ones that I wanted to share, you know, like I mentioned, Charla, Dr. Greco, this is him winning an award, spending time in Guatemala with Dr. Yang and Yulia and Russell Wu. The time with my chief class, Steph Chow, Greg McGee, Owen Palmer, Danielle Zimmer, Yijin Chin, just like phenomenal moments. This is the chief's dinner, and you see here Dr. Norton, who's so wonderful. You know, I sent him a text message to congratulate him the other day, and he replied back that I meant so much to him. It was just so touching. And then here you see colleagues, Dr. Garland, the Valley, Kaiser. It was just such a phenomenal experience seeing so many different disease, you know, so many different hospitals, different practices, and learning from so many wonderful faculty. And here you see Jason Lee even came to Houston to visit for a vascular course, and Bethany was also a fellow in Texas at that time in Houston. So we all got to hang out. And then, you know, over the years, we've continued to grow and, you know, have life moments and share that with each other, and, you know, see each other at conferences. And, you know, Dr. Spain and I always have to take a photo at every conference. And I really do have to say that I'm so thankful to you, Dr. Spain. You probably also don't even maybe remember this, but maybe about 5 or 6 years ago at the college, you gave a talk on becoming a successful junior faculty member in academic surgery or something like that. And you shared like it was just a wonderful talk. And I was like sitting there thinking, oh my gosh, I haven't done any of these things. Like, what's going to happen to me in my career? And I was just, you know, stayed behind, and you talked to me, and we sat down, and you shared with me, and you really just helped me to have a different mindset and a different perspective. And I think that was just so meaningful. So I'm so thankful for that. And I love going to the SSO and seeing Dr. Poltsides and Dr. Wapner, who've also been able to help me so much, especially as I continue to take on different leadership opportunities and think about those. And then, you know, the ASBRS, the ACS, it's just always so much fun to find the Stanford surgery colleagues at conferences, and just still always learning from so many of you. And then I just wanted to also thank, you know, Dr. Wren. Thank you. So that I see her right there. And also the other colleagues that I've come to learn or come to know after I've left Stanford that have continued to grow this program and, you know, didn't train me. We weren't residents together, but still, you know, we are just all so connected, and I've learned so much from all of you as well. I'm so thankful for that. And then Anita, who's the heart and soul of the residency program. And I think that everyone here would agree with that. And she was really the first person I met at Stanford Surgery. That was at SNMA. I don't remember where it was, but it was at SNMA. And I just have appreciated all of your friendship and support over the years. So, okay, this is the end. As I mentioned, you know, my heart is just so filled with gratitude, and I'm just really aware that, you know, anything I have been able to do or contribute is because of everyone that's here and everything that you've given me, all your teaching, all your talks, all your advice, all your time, just everything. And so for the prospective residents, you know, I just wanted to share with you that I really think that Stanford Surgery, you know, leading from the heart, this place represents leaders that have heart, they have caring, compassion, courage. They lead with their heart, with their core, with a purpose, with intention. And, you know, this is a place where you will have exceptional training and really world-class leadership and amazing faculty. And you'll be able to rely on this training wherever you go and whatever you do. I think you'll learn to stay laser focused on the patient and really focus on and learn from your patients, and and listening to them and really keeping them at the center will serve you so well. I think you'll learn that this is a place where you will invest in your colleagues and teams and your own well-being, and others will also in turn invest in you. That it's really important to have like the bright mindset. You know, it's really a privilege what we're able to do. And, you know, that it's really incumbent upon us to create these opportunities and these futures and these environments. And that frame shift can really be helpful as well. This is a place that's like so full of innovation, creativity, forward thinking. You know, as I was reflecting back, I mean, it's all the themes that we talk about now are the themes that I learned here, you know, over 10 years ago. And, you know, ultimately, this is a place where you'll have lifelong mentorship and friendship and sponsorship. And, you know, even after you leave, you'll always be a part of the family, whatever career path you choose. So I thank you for your attention. I thank you so much for the warm welcome. Thank you for everything. I hope that in some ways this was able to resonate with some of you on some level. So thank you again.